Hello to everyone from Geneva, from WHO headquarters. It's 18 September 2025. My name is Tarek, and I'm welcoming you to this press conference on global health issues. As you have seen in our media advisory, today we are focusing on non-communicable diseases. Next week, the UN General Assembly is entering its high-level week, and the main health event will be a 4th UN General Assembly high-level meeting on the prevention and control on non-communicable diseases and the promotion of mental health and well-being. Leading up to this event, today WHO is launching and publishing its updated investment case, saving lives, spending less. Many of you have requested this investment case document and accompanying press release in advance. Hope you have read it and you are ready to ask questions on it. For those who have not read it, it will be published very shortly. So I will now just introduce our panelists here in the room. We have others online that I will mention a little bit later, but to start with, as always, we have our Director General, Dr. Tedros Adhanom Ghebreyesus. With us is also Dr. Chikwe Iyekwazu, Executive Director of Health Emergencies Program. Dr. Jeremy Farrar is WHO Assistant Director General for Health Promotion, Disease Prevention and Care. To speak specifically about NCDs and investment case that we are launching and what is going to happen at the UN General Assembly next week on non-communicable diseases, we have Dr. Deborah Kestel. She's a Director ad interim of the Department for Non-Communicable Diseases and Mental Health. We have Dr. Etienne Krug, Director of the Department of Health Determinants Promotion and Prevention. We also have Dr. Guy Fownes, who is a cross-cutting lead, Department of Non-Communicable Diseases and Mental Health. With us in the room is also Mr. Steve Solomon, Principal Legal Advisor of WHO, and we also have Roberta Andraghetti, Technical Officer, working also on the international health regulations. With this, I'll give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening, and thank you for joining our presser. First, yesterday was World Patient Safety Day. Around 1 in 10 patients globally are harmed in healthcare, and more than 3 million people die every year due to unsafe care. This year, our focus is on patient safety for children. Children are not small adults and should not be treated as such. They need medical care that's tailored to their age, size, development, and life circumstances. The most common cause of harm in child patients are medication and diagnostic errors, infections contracted during care, surgical errors, and missed warning signs when a child's condition gets worse. We can address these problems through safer systems, supported health workers, and engaged children and families, because nobody should be harmed when seeking care. Next week, I will join world leaders in New York for the United Nations General Assembly. The highlight of the week for WHO will be the high-level meeting on non-communicable diseases and mental health to be held next Thursday, the 25th of September. Non-communicable diseases, or NCDs, include 7 of the world's top 10 causes of death, including cancers, heart disease, diabetes, and chronic respiratory disease. NCDs are the world's leading cause of premature death, killing 18 million people every year before the age of 70. In addition, more than 1 billion people face mental health conditions, and suicide is the 3rd leading cause of death among young people. Apart from cutting lives short and robbing families of their loved ones, this does also incur huge costs for health systems and economies. In the Sustainable Development Goals, countries set themselves a target to reduce premature mortality from NCDs by 1/3 globally by 2030. There has been some progress. The new Lancet NCD countdown, supported by WHO, shows that in nearly 80% of countries, deaths from NCDs declined between 2010 and 2019. However, progress is nowhere near enough to meet the SDG target. In 60% of countries, progress has slowed compared to the decade before, and in some places, deaths from NCDs are rising again. The main outcome of next week's high-level meeting will be a political declaration, which countries have been negotiating for the past year. The draft declaration includes concrete and ambitious targets: to see 150 million fewer tobacco users by 2030, to see 150 million more people with access to mental health care, and to see 150 million more people with hypertension control. Next week, WHO will publish a report with new estimates on the number of people living with hypertension. Hypertension can be controlled with medicines to lower blood pressure, but in most low-income countries, people do not have access to those medicines. Hypertension control is one of a range of evidence-based, cost-effective tools countries can use to meet the targets in the declaration. We call them the best buys. These include raising taxes on tobacco and alcohol, protecting children from the marketing of unhealthy food, promoting physical activity, improving diets, and screening for cancer. They are all proven, practical, and ready to use. Today, we're launching a new investment case for NCDs, which shows that implementing these best buys would cost countries about $3 per person per year. We estimate that for every dollar countries invest in the best buys, they can expect up to a $7 return in social and economic benefits. By 2030, fully implementing these best buys could save 12 million lives, prevent up to 28 million heart attacks and strokes, and generate over $1 trillion in economic benefits. This is not theoretical. Countries are doing it. Brazil has cut smoking rates in half by steadily increasing tobacco taxes. Mexico's tax on sugary drinks reduced consumption while raising significant government revenue. Thailand channels tobacco and alcohol taxes into its National Health Promotion Foundation. There are many more examples which show that with the right policies, change is not only possible, it is transformative. Investing in NCD prevention is not a cost. It's one of the smartest economic decisions any government can make. But often, governments face fierce opposition from industries that profit from unhealthy products. The message is clear. Countries that act decisively will save millions of lives, protect families, cut health costs, and unlock economic growth. Those that delay will pay the price in lost lives, rising healthcare costs, and weaker economies. We look forward to countries adopting the political declaration next week, and more importantly, to implementing it. Now to the Democratic Republic of the Congo, DRC. It has been 2 weeks since the government of the DRC declared an Ebola outbreak was declared near the central town of Bulape. So far, 48 confirmed and probable cases have been reported, and 31 people have died. I congratulate the government, the Ministry of Health, and DRC's institutions for their leadership in this response. Years of investment and experience are paying off. WHO and our partners are supporting the government. So far, we have delivered more than 14 tons of essential medical equipment and supplies and deployed 48 experts. More than 900 contacts have been listed and are being followed up. Vaccination of contacts, potential contacts, and frontline workers is underway. We have also helped to set up an Ebola treatment center with 48 beds with 16 patients currently being treated. Courses of the monoclonal antibody therapy MAB114 have also been sent to treatment centers in Bulape. And so far, 14 patients have received the drug. And on Tuesday this week, the first 2 patients to recover were discharged. This week, WHO launched an appeal for $21 million to support DRC to scale up its response. We ask donors to support this response, and your investment now will help to save lives and stop this outbreak at the source. The outbreak is another example of the need to build strong emergency response capacities nationally, regionally, and globally. At the World Health Assembly last year, WHO member states adopted a set of amendments to international health regulations. Tomorrow, those amendments enter into force. The key changes include the addition of a new level of global alarm, a pandemic emergency, which is higher than a public health emergency of international concern that we call FIC. The amendments also include the creation of national IHR authorities to coordinate the implementation of the regulations in countries. And they include provisions to strengthen access to medical products and financing based on equity and solidarity. As you know, at this year's World Health Assembly, member states also adopted the WHO pandemic agreement. And this week, they are negotiating an annex to the agreement, the pathogen access and benefit sharing system, which aims to ensure faster sharing of pathogens with pandemic potential and equitable access to the medical products needed to respond to them. We expect the outcome of these discussions to be adopted at the World Health Assembly next May, following which countries can sign and ratify the pandemic agreement. Finally, to Gaza. Israel's military incursion and evacuation orders in northern Gaza are driving new waves of displacement, forcing traumatized families into an ever-shrinking area as famine persists. Gaza's health system continues to be overwhelmed by the influx of mass casualties, limited medical stocks and supplies, and the shortage of medical equipment and blood units. Yesterday, the Al-Rantisi hospital was attacked while 80 patients were inside, the only specialized pediatric hospital left in the Gaza Strip. Escalating violence blocks access and prevents WHO from delivering life-saving supplies. We continue to call for an immediate end to these inhumane conditions. We continue to call for the hostages to be released, and we continue to call for a ceasefire. This Sunday is the International Day of Peace. if there is one thing our world needs desperately right now in Gaza, Ukraine, Sudan, and elsewhere, it is peace. Not just one day, but every day. Tariq, back to you.
Thank you very much, Dr. Tedros. Coming back to UN General Assembly, yesterday we have sent to you a detailed media advisory on activities, health-related activities, so you can get all the information there. Also on Monday, we will share with our global media list document that is a toolkit for reporters on how to report on non-communicable diseases. This has been done in cooperation with reporters, so it's something that we hope will be useful for all of you. Before we start with questions, let me just tell you who is on the line from WHO and who could be asked to answer your questions. We have Dr. Rick Pieperkorn, WHO representative for the occupied Palestinian territory. Dr. Abdirahman Mahamoud, Director for Health Emergency Alert and Response Operation. We also have Dr. Werner Obermeier, who is Director of WHO Office at the United Nations in New York. And we have Dr. Nedret Emiroglu, Head of the Secretariat for the Intergovernmental Working Group on WHO agreement. And let me not forget Dr. Joachim Hombach, who is Executive Secretary for WHO Strategic Advisory Group of Experts on Immunization, or SAGE. With this, we will start with questions, and first we will go to Health Policy Watch and Kari Kalinen. Kari, can you please unmute and go ahead?
Thank you, Tariq. The zero draft of the UN high-level meeting declaration recommended taxes on tobacco, alcohol, and sugary drinks, but the final draft simply asks countries to consider higher taxes on tobacco and alcohol and drops any reference to taxing sugary drinks. Please, can you comment on the weaker language on health taxes in the declaration, and also on the failure of your own Best Buys to recommend taxing sugary drinks, despite ample evidence of their impact, including in Mexico? Thank you.
Thank you very much, Kerry. Well, should we maybe start with Dr. Obermeier, who is hopefully online from New York?
Yes, good morning. I think if one looks at the text of the final political declaration, which was just circulated by the President of the General Assembly a day or two ago, there is very strong language in the text on taxation for alcohol and tobacco, marketing restrictions, and also in terms of regulation of food products. So one should look at it holistically. It is, of course, one of the tools that the General Assembly has adopted. There are many others, the Financing for Development Conference outcome and the World Health Assembly outcomes and resolutions and decisions, of course, also come into play. So holistically speaking, it is a very strong outcome document. If implemented, will save many hundreds of millions of lives and encourage governments to take the necessary fiscal and regulatory steps.
Thank you very much, Dr. Obermeier. Dr. Krug, would you like to add something?
Yeah, just to complement Dr. Obermeier's comments and respond also to the question regarding the Best Buys. Taxing sugary drinks has full support from WHO. We believe strongly in this as a very cost-effective intervention. It did not meet the strict criteria of Best Buys, which were met by tobacco taxation, for example, or alcohol taxation. But still, it has full support from WHO as an effective measure.
Thank you very much, Dr. Krug and Dr. Obermeier. Let's go to next question. We have Carlos Monteiro from Triffin News. I understand Carlos has several questions on NCDs, but maybe we will go for one or two. Carlos, please go ahead.
Thank you very much. So WHO data often shows big gaps between high-income and low-income countries in terms of NCD prevention and treatment. How are you ensuring equity in access to care beyond recommendations? Thank you.
Thank you very much. Maybe Dr. Kestel can start.
Yes, thank you, Tariq, and thank you for the question, and thank you for the start, because the answers are complex, so we may need to complement. But I think that what it is to highlight in the draft political declaration is the measures to proposed to achieve those targets with numbers that are there. The 150 million of these different areas that have been included in the political declaration, some targets that are related to processes and how many countries, what is the percentage of countries that need to achieve some of those processes in terms of policies, in terms of legislation, in terms of different areas that have been financing. And so through those mechanisms is that we can aim at some equity and some movement across all countries, whether they are low, middle, or high-income countries. So I think I will emphasize those aspects to make sure that can be used with different mechanisms that will have to be developed to go beyond the split between low, middle, or high-income countries.
Yes, Dr. Fons, would you like to add something?
I would, because I think the response from Dr. Kestel was excellent, and I'd just like to add that, and linking to the response from Dr. Obermeier, we believe, again, that the political declaration, as we see it now, the draft, is the strongest we've had. And it is because it has delivered on its call for equity and integration, which is actually the title of the high-level meeting. And it has identified, and we appreciate the extreme leadership, the amazing leadership from the co-facilitators and the President of the General Assembly, but also the member states themselves who really walked through a very complex path to arrive at the final draft. And that final draft does point to key areas that will address equity gaps and will respond to the incredible needs of people living with NCDs in vulnerable situations, on pockets of underserved populations, marginalized communities, etc. I think it's an extremely powerful declaration that will point to exactly that. Thank you.
Thank you very much. So let's go to the next question. We have Carmen Paun from Politico. Carmen.
Hi, thank you so much, Tariq. I have two quick questions, if I may. Just the first one on NCDs. There's obviously a big debate here in the United States about, non-communicable diseases and making this country healthier again. But what you would often hear the health secretary here say is that despite spending so much on health in the United States, the country has really a lot worse outcomes than comparable countries. So I was wondering if there's sort of like any view from the WHO on the agenda here on NCDs. And the second one, a quick one on the IHRs. Can you say how many countries opted out and who those are? Thank you so much.
Okay, so we may start with the first question on NCDs, and then we will come back to IHR. I'm just looking to my colleagues. Dr. Krug, would you like to start, or Dr. Fons, whatever?
I can certainly provide part of an answer. I think when we talk about NCDs, it's very important to recognize that we're going against very strong financial interests. There are a whole series of unhealthy products on the market right now, ranging from tobacco, unhealthy foods, alcohol, etc. And acting against the interests of some of these very powerful companies is not always easy and not always done with the same energy by different governments. But unless we do take action to promote healthy products and limit the sale of unhealthy products, we will not make enough progress on tackling NCDs, and not fast enough.
Yes, thanks. I think this is interesting because it links very much to the conclusions of the NCD countdown report from the Lancet. very much supportive of WHO and co-authored by WHO. It really points to the fact that we can learn from some of these cases, as mentioned in the question, where the history has been that the cost-effective best buys and other cost-effective interventions do work, and they have worked for decades in countries. And as we move forward into additional areas of equity gaps, underserved populations again, and changing epidemiology and demographics in countries, we need to sort of understand the context in countries so we can reach that last mile. And how can we scale, sustain some of those cost-effective best buys and adapt them to the context, changing context in these countries? So one element is cost-effective interventions do work, and they have worked for decades. How can we then, moving forward, understand those equity gaps, underserved populations, where we need to contextualize these best buys even more? Thanks.
Thank you. Dr. Farrar?
Yeah, thanks, Carmen, for the question relating to the United States. I mean, we would very warmly welcome all countries addressing the issue of non-communicable diseases and mental health. There is no country on earth that isn't in now and in the coming years going to be challenged with the issues of non-communicable diseases and mental health. Demographic shifts, multimorbidity, where people have more than one condition, is going to be an issue for health systems all around the world, including in the richest countries of the world. And actually bringing the countries together, working together to learn what works in one country and what works or does not work in other countries would be a huge step forward. And that's ultimately the heart of the political declaration that will be signed next week. The truth is that unless we can promote more health through promotion and we can prevent illness, and then for those that do suffer from illness, we can care for their individuals and their families in every country. We won't succeed in addressing the issues of non-communicable disease and mental health. So we would very warmly welcome the initiative coming from the United States on non-communicable disease and mental health.
Thank you, Dr. Farrar. Maybe let's go to this. Sorry. would you like to add something?
Okay. I think Jeremy and colleagues have already addressed, but just wanted to add just a couple of lines. On the Secretary of Health's position on non-communicable diseases, it's one thing that actually as WHO, we really support what he says, because the US is one of the countries that's most affected by non-communicable diseases. If you take one measure, for instance, obesity, the US is in the top 20 countries in the world. And he's right when he says, non-communicable diseases are top health problems. But not only that, the solutions he proposes in health promotion is what we are advocating for many years now. Physical activity, no alcohol, quitting cigarette smoking, and nutrition, all this addressing the root cause of non-communicable diseases is important, and we quite agree. And what he says normally about the big investment in the US in the health sector, but that the US is not getting the right return is also true. And the reason for this is the focus in the US is not on health promotion and disease prevention, but it's on treatment. And of course, treatment means treating cardiovascular diseases, treating cancer, treating other non-communicable diseases is very expensive. It would be more effective if the country can invest in addressing the root causes, and quite agree that the investment or the expenditure in health is disproportionately high in the US because of what he says and what I said, and that WHO has been advocating for many years. And as has been said by Jeremy, would be happy to work with the US to give this actually a priority, and we expect the US to lead on this. On the IHR, I don't know if anyone is you want. Okay, so first maybe I would prefer if Steve can say, and then I will take if there is anything remaining. Okay.
Thank you very much for the question. Thank you very much, DG. I'll just very quickly go over the facts that I think the questioner wanted to know about states which rejected the IHR amendments. Let me just frame this by saying that the IHR 2005 were drafted over 20 years ago. So the amendments that were adopted in 2024 were quite significant and significantly strengthened the IHR. And it is those amendments which strengthen the IHR which will come into full force and effect tomorrow. The exact names and numbers of those handful of states that rejected the amendments will be published tomorrow on our website when the complete amended text is published. But what I can say is that among the states that rejected, this handful of states, the U.S. was one that publicized their rejection. They remain a party to the IHR. This is important because it's notable that the 2024 amendments, which took lessons from the COVID pandemic, were led by the United States. The U.S. proposed the negotiations and was one of the countries which helped lead them. They played a big part in this successful effort. We hope that they and all the other countries, this small handful that rejected, will keep an open mind about withdrawing their rejection, because the IHR continues to be the only global, nearly universal, legally binding instrument that has countries working together, cooperating to face the threat of the international spread of disease. And these 2024 amendments are a significant strengthening of those important regulations.
Yeah, thank you. Thank you, Steve. Maybe I would like to add to IHR. The U.S. actually was the first country that proposed the amendment of IHR. And not only was one of the few countries, and actually the first to recommend, but led it to the successful conclusion of the IHR, and as far as I know. And I hope U.S. will reconsider and join the new amendment, because the contribution from the U.S. has been very, very significant until the conclusion of the agreement. And the agreement has really improved a lot and significantly, as I said in my statement, and addresses many of the weaknesses that we have identified during the COVID response. These are COVID lessons. And I don't think there should be a difference with the US, actually. One thing that surprised me, because this is an update and even an improvement to the previous, an upgrading of the previous IHR, which lacks some elements, and that has been improved now or upgraded because of the COVID lessons. So we have differences with the US on that, but as you know, on vaccines as well, the positions of WHO and the US are not compatible. Although, as I said earlier, on NCDs, on non-communicable diseases, and on focusing on health promotion and disease prevention, as the State Secretary, RFK Jr. Says, we agree on that. So we will continue to engage the US to work together on issues we agree, and continue the dialogue on the issues we disagree. Thank you, and Tariq, back to you.
Thank you very much to all of you, Mr. Solomon and everyone else who answered the first question on NCDs. I understand Dr. Rick Peppercorn, our representative in occupied Palestinian territory, has to leave, and I assume there would be a question on Gaza, so why don't we just go quickly to Dr. Peppercorn for a quick update on the situation there, and then we can let him go. Dr. Peppercorn.
Thank you very much. Maybe let me just focus on an update of the hospitals and maybe add a little bit what DG has alluded to. So currently, we're only talking about 17 of the 36 hospitals, which are partly to minimum functional, and 68 of the 180 primary healthcare, which are partly functional, and 10 field hospitals. What we currently see is directly a critical shortage in the blood units, component blood bags, transfusion sets, etc. Services could shut down within days without urgent replenishment. The hospitals require at least 350 units of blood daily due to the ongoing violence, especially related to the ongoing bombardments, specifically in the north, but also accessing food distribution site and convoys. The hospitals in Gaza City, they have become hellscapes. They're overwhelmed, they're low on supplies, patients on the floor, patients actually everywhere. And just want to remind everyone, almost half of all functional hospitals are in Gaza City. So if these hospitals are put out of services, it means that 36% of all hospital beds, but over 50% of the ICU beds in the Gaza Strip will be lost. And we know that even if hospitals are not asked to evacuate, the lack of access, violence in their vicinity will make them very quickly minimum functional and non-functional. So again, the hospitals and healthcare in Gaza must be protected, never attacked, nor militarized. Also in the south, hospitals in the south overwhelmed and can't absorb more. The quality of care, just to mention two areas, hemodialysis units in the south, currently very much compromised. Increased workload, shorter, fewer sessions, etc. Everyone switched to 2 sessions instead of 3 or 4 sessions a week. There's a unit in Al Zaweda, the caseload increased from 53 patients to 95 with only 23 machines. And a unit in Nasser Medical Complex, 233 patients. Now we see 15 to 20 new patients from the north, only 33 machines. When we talk about the humanitarian zone, we often hear about the incursion ongoing in the north and all people being forcibly or being forced to evacuate to the south. We call about the humanitarian zone. The whole of Gaza Strip, 365 square kilometers. The humanitarian zone, the so-called humanitarian zone, is only 43 square kilometers. It's 12%, less than 12% of the Gaza Strip. And that's 12% only includes 77 of the 229 functional health service points, only 3 of the 17 hospitals, 5 of the 10 field hospitals, 20 of the 68 primary healthcare units, and only 42 of the 112 medical points, and 7 of the 22 ambulance centers. So in short, this should definitely stop as the DG also raised. We absolutely need a ceasefire. The last point is the impact on women. We see catastrophic consequences on the Gaza City offensive, on sexual reproductive health services for women and girls. The access to care is increasingly constrained as families must travel long distances on damaged roads, limited supplies, etc. In Gaza, women always used to deliver at health facilities. And in the first 7 months of 2025, we almost see 500 deliveries which took place outside hospitals. We see way too many preterm babies, too small, incredibly worrisome. The health attacks we mentioned is not just Al-TC in the north, also the St. John's Eye Hospital is out of services and a number of primary healthcare centers. I want to leave it there. Thank you. Over to you.
Thank you very much, Dr. Pieperkorn, for this update. We have an Anadolu news agency, Beza Domez. Beza, please go ahead.
Thank you, Tariq. I want to ask about yesterday's Gaza Health Ministry's remarks. In their remarks, they accused Israel of deliberately obstructing the WHO's effort to deliver fuel to hospitals in Gaza City. Can WHO confirm this, and what is the current situation on the ground? Thank you.
Let me see if Dr. Pieperkorn is still in front of his screen and
Yes,
can
I'm
answer
sorry.
that. Thank you, Dr. Pipkun.
Talked about Rontisi Hospital, am I correct? No?
Question was on possibility of bringing fuel and to hospitals, and what has been said by the Ministry of Health of Gaza regarding obstructions of bringing fuel.
Yes, okay. Yes, I get you. So, yeah, WHO, and actually through the One UN system, we are also indeed distributing and assisting the hospitals, health facilities with fuel, besides medical supplies, essential medicines. We also do the assessment on the needs, etc. And on 15 September, I mean, like the UN, we tried to attempt to bring up fuel to the north, from the south to the north, to Al-Shifa Hospital, for example. And what we saw, again, we see, of course, a massive displacement going on along the coastal roads, and desperate people, but also in needs. I mean, there's a huge need of fuel. I mean, many people can also not leave the north because it's incredibly expensive to actually travel with all their belongings. So that fuel transport got partly looted the crowds and compromised the safety of the mission. So the mission had to be cancelled, and I think it just reflects how incredibly desperate the situation is, like for the people in Gaza, but also I think for the humanitarians try to assist. Over to you.
Thank you very much, Dr. Pipkun, for this update. I think we have a time for one question, and if I'm not wrong, we have Catherine from Vital Signs News. Catherine, could you please try? We have a question in writing, but maybe you can try to come in and ask yourself.
Hello, can you hear me?
Yes.
Terrific. Okay. The press release refers to progress on NCD slowing since 2019 and a resurgence of NCDs in some places or in some instances. What would you attribute this to? Can it be solely linked to the pandemic? And is that would that be because of health services and lack of access, or because of the disease itself, or is there another reason? Thank you.
Thank you very much, Catherine, for this question. Dr. Fons.
Thank you for the question. Yeah, the fast answer is that the decline in progress, we see exciting progress across many countries, but the global decline in the speed of that progress is really slowing in commitment, scalability, and sustainability of these cost-effective, highly impactful and proven interventions. So that's the short answer. The longer answer is that we need to understand how some of these interventions are being implemented in different contexts now. There was a rapid acceleration of progress in the reduction of premature mortality and overall mortality due to the excitement of implementing some of these best buys a decade ago. Now, the stagnation or the plateauing of what we see in the numbers is relevant to, first, as you mentioned, the impact that the pandemic had on health systems, and in particular on the attention addressing the needs of people living with NCDs and mental conditions during that pandemic. We've reversed some of the gains before the pandemic. That's one very important element. But also, we have to understand now that the best buys have lost the commitment in some countries, the scalability of them, and obviously sustaining these interventions in the long run in different contexts. And the lessons learned that our ADG was mentioning, lessons learned in some of the successes of high-income countries or good achievers in implementing, and those that have more constraints and more complexities.
Thank you very much, Dr. Fons, and this will conclude today's press briefing. During the press conference, you have received the press release and the investment case, and as always, we will be sending Dr. Tedros' opening remarks and video and audio recording of this briefing in coming hours. With this, I'll give the floor to Dr. Tedros for his closing remarks.
Thank you. So thank you to all members of the press for joining us today, and see you next time.